We can start the session now.
Mikey, shall I start?
Please, yes. Let's start.
Great. Let me begin by thanking Development Monitoring and Evaluation Office, DMEO, Niti Aayog, for inviting UNICEF to host a panel as part of the second National Conference for Monitoring, Evaluation and Learning 2022. Colleagues, really welcome for this important conference. And I'd like to thank also for this excellent partnership through which UNICEF is supporting the DMEO team in its progressive work to strengthen the M&E ecosystem at national and state levels. I'd like to thank Director General Dr. Shukha Bonu and other DMEO colleagues for your initiatives in organizing this conference. At UNICEF, we have learned that development is only as effective as granularity and disaggregation of data. The first step to addressing vulnerability is to be able to locate it and measure its impact geographically, within families, across gender and class, and under the impact of factors like climate change. Our work on evidence spans from big data to community-based monitoring, which can capture the intersection of real life and gives voices to the most vulnerable quickly during the times of crisis, such as global pandemics we went through. It is the core of our work globally to supporting governments and stakeholders evaluate impact so that social services that can concretely realize the right of every child. Evaluations in particular are a powerful tool to provide credible information of what works for whom and where. They can ensure accountability and guide us towards improvement. And the inclusive evaluation can empower individuals as owners of development. Being counted is crucial and critical, but being heard is what makes all the difference. Given the setback of COVID-19, and with only 8 years left to achieve the SDGs, evaluation will play an even bigger role in helping us address multiple and intersectoral vulnerabilities rapidly, so we can build back better and faster. We must author evaluation process that are particularly sensitive to the needs of those who are most vulnerable, particularly children, adolescents, and women. And today, you will hear from our brilliant panelists how we can do this. It is my pleasure to introduce the moderator and the panelists with us today. My colleague, Maike Bika, will moderate the session. Maike is a monitoring and evaluation specialist at UNICEF India in Delhi office and oversees our research, evidence, and evaluation work. Before joining UNICEF, Maike worked as a senior research manager at the JPAL, leading randomized controlled trials in immunization, adolescent empowerment, education, and sustainability. She has also worked with the Dalberg and the University of Cambridge. Our first panelist is Mr. Khalil Bitar. Mr. Bitar is an independent evaluator from Palestine. He has spent 13 years as an evaluator and a researcher with multiple governmental institutions and NGOs in several countries. He's the founder of Palestine Evaluation Association in 2013 and the board member of the MENA Evaluation Network, as well as co-founder of Evaluator Global Network and the Evaluator for Action Global Campaign. Our second panelist is the Dr. Renu Sin. Dr. Sin is a country director for Young Lives India. She has over 27 years of experience in policy analysis, monitoring and evaluation, and research both in India and abroad. Educational psychologist and educator, she set up the Center for Early Child Development and Research, Jamia Mila, and the School of Rehabilitation Sciences at Delhi University. She has also served on the working group for the national policy for early childhood care and education. Our third panelist is Ms. Ritu Nanda. Ms. Nanda provides support to the Global Fund for Children's India-based partners, helping them to strengthen their merit systems. At the Institute of Social Studies Trust, Ms. Nanda moderates gender and evaluation online community of practice. So welcome to all our panelists. And with this, I'll now hand over to Mikey to start the session. Thanks very much. Over to you.
Thank you very much, Yas, for those inspiring opening remarks. So I think what I'll take you through very quickly is what we hope to discuss in this session. You will hear from each of the panelists what we actually mean by inclusive evaluations and designing inclusive evaluations and how they can be made more responsive to the needs of especially women, adolescents, and persons facing disability. I just wanted to start with providing a very brief overview. When we talk about inclusive evaluations, we mean evaluations that in their design, implementation, and their use ensure that the rights and the needs of the most marginalized are realized. And in this context, we're looking at aspects such as making sure we're evaluating outcomes that are the most relevant for children, adolescents, and women, collecting and analyzing disaggregated data by gender, age, and other equity dimensions, involving often excluded groups in the evaluation process, and importantly, establishing a feedback loop back to children, adolescents, and women with evaluation findings, but also the actions that have been taken as a result of evaluations. And I think in the cooperative federal system like India, an inclusive approach to evaluations can also be developed through the active involvement of some of the lower levels of governance, as well as community representatives. Local government officials, community representatives have a better sense of what the ground realities are and the needs of children, adolescents, and women, and also the types of data and information that is available. So following a decentralized approach and involving all of these multiple stakeholders can actually make an evaluation process and its outcomes more responsive. I was going to talk to you a little bit about some examples of UNICEF, but I think in the interest of time, we will skip through to our panelists because they're eager to tell you their examples and experience. I will first move on to just a few housekeeping rules. So yes, there we go on the Q&A. So the way that this session will work today is that we will ask each of the panelists, each of the three panelists, to give a very brief 10 to 15-minute presentation that they've prepared beforehand. And then I will kick off the question and answer session with some questions that I have already prepared for each of the panelists. The chat box is available for any participants to ask questions. You will see that on the screen right now, the Q&A button. Please do post your questions to us publicly so that in the chat box, as I monitor it, I can see them and I can curate a few of your questions to pose to the panelists at the very end. With that said, this, I think, is just to tell you that if you're logging in from the mobile app, that you can have a better viewing experience, leaving that here. And then off to the first session, I would say, if we can go on to the next slide. There we go. I'd like to introduce Mr. Khalil Lutar. Over to you, Khalil, for your presentation.
Thank you so much, Micah. Can you hear me okay?
Yes, perfectly.
Perfect. Thank you so much for the introduction, and Mr. Kimura. It is a pleasure and a privilege to participate in the panel about this vital topic, as both of you mentioned, of inclusive evaluation. And good morning to everyone. It is this topic we are discussing today is a very important topic, but it's also a topic that is difficult to address, and we should put this in the beginning. It's difficult to address on the ground because there are so many complex reasons where it becomes very difficult, whether political, ethical, practical, or financial, as well as we can even come up with, or at least reference so many other rationales. The evaluation field per se has also a complex relationship with inclusive evaluation and considering equity and social justice issues in general in evaluation. It is sometimes, or actually often, discussed considerably in literature and theory. But when push comes to shove and doing things on the ground, then it becomes a little bit more difficult for the reasons we mentioned. But there are a lot of progress. There is a progress and a lot of ways as well that the field has a progress on this. Evaluation methods in general for equity and inclusive evaluation are also in short supply. I will speak a little bit about that and how perhaps we can address or think about ways to address equity and inclusion issues more systematically and in practice that I hope that is helpful for you. So in this slide, just to say that some of the things I will talk about in this presentation are based on the work I've done on social equity assessment in evaluation, and a tool that is in front of you about social equity assessment, social equity assessment tool it's called. And I will present a little bit about how to use the tool later. But just to note that, unfortunately, all too often, we focus on one or two dimensions of equity and social justice. For example, gender or disability or sexuality, but not necessarily that we look at things as a whole. And we pay less attention to these aspects, which are crucial to people's and right holders, marginalization, vulnerability, and exclusion. Next slide, please. So here we can see that focusing on one or a limited number of aspects of equity and inclusion is very much like the representation or the design there here on the left, this carbon tunnel vision. It's not from equity perspective, but from carbon, I think environment and equity has a lot of things to do. And this somehow a tunnel vision where we focus on carbon emission, for example, but pay less attention, or worse, no attention at all sometimes, unfortunately, to other crucial factors like resources, poverty, education, and so on. And perhaps as important, how this, and this is actually perhaps more important, how these factors are actually interacting and what is the relationship between themselves and how they are interacting. It's very important to consider this. This is the graphics on the left is very similar to equity issues on the right, intersectionality of both power and marginalization, because both power and marginalization have intersectionality. And just to say as a disclaimer, even that is oversimplification of what is really intersectionality is, but we try to present it to be a little bit closer to us. Except I think it's more difficult and more complex when it comes to intersectionality than carbon tunnel vision, is because we are dealing with the human beings, and there are so many factors affecting one person's life and community life more than other contexts. There are many ways of marginalization, as you see, and power and privilege play a crucial role. And for true inclusive evaluation, we should at least look at multiple, like Micah said before, multiple of these issues, and not fall into the mistake of oversimplifying the process. Inclusive evaluation means really to be inclusive of multiple factors as possible, and with constraint, we know that. We will talk about this a little bit, but it's important to consider that. Next slide, please. And here it comes a little bit talking about the systematic, as much as possible, equity assessment evaluation. And just to, I know this is a complex topic and we have so many things to consider, but perhaps I thought it's useful to look at 2 or 3 items that I think from practice and from literature, what is really helpful in doing inclusive evaluation. First, there are, you see the top items there, the 8, the geographical, economic, gender, and so on. So these aspects are all related to the rights holders' demographic features. These are very important as much as of these dimensions to take into consideration when doing evaluation. Because it's not enough to look, for example, into rural areas without looking at refugee camps, for example, or looking into a certain sect or religion and not the other. Because you can do an evaluation and say, wow, the results are great. Yes, they are great to certain people. But if you don't really consider the different dimensions, then it's a problem. But it's not only about the dimensions themselves. It's also about 3 items here on the circle that they're very important to consider. First, it's the outcome, the equity in outcome. Yes, it is important that we want to have equitable outcomes. But is it enough? Even if all people benefited the same, first, if it's equality, maybe it's not equitable, because you want also people who are more vulnerable. You want to, with evaluation and with intervention, you want to try to address inequality. So first, you want to see about how equitable the benefits are. But second, how much did your intervention has contributed to inequality or inequity, or decrease it or increase it, because that's very important. Sometimes you do an intervention for empowering women, for example, household head, women, I mean, in any household. And then sometimes you create problems within the culture, the context where you are, if you don't do it very carefully. Of course, you have to empower women, but you have to be also intentional about how you do it. There are so many projects and programs and interventions that really want to do something good, but they end up sometimes doing not so good. And evaluation is a tool to tell you, or at least inform you to a certain degree possible, that actually you are on the right track or not. And the third aspect is very important, that is the participation and involvement. There's no, I could say that, and my colleagues who will speak after, or Mike can correct me, but I feel that there is no inclusive evaluation without the involvement of people. You can have the most beautiful evaluation design, but if you don't involve the rights holders, beneficiaries, otherwise called, I don't really like it, but if they are not involved in the processes, even the design of the tool somehow in a participatory way, this is not only in evaluation, also in intervention. So let's move a little bit to these cross-cutting issues. And just to quickly say that even when you're doing inclusive evaluation or intervention themselves, you have to think about the intervention team, the evaluation team, the data collection methods. All of these aspects are very important, because sometimes you could have people who are doing the evaluation and not informed about the context. They come from certain backgrounds that they don't really feel, the context there. They don't know how to measure this equity and equality. So you have really to consider those issues in the intervention team, in the evaluation, but also in the tools and the processes. And because equity is tightly linked to the environmental, as Mr. Kimura said about the environment and the SDGs, everything is connected. Environmental justice we see in India, but in so many countries in the region and outside, that the environment is leading to poverty than so many other factors. So in evaluations and intervention, it is important to look at environmental justice. And in the tool, once you see it, or we have another session perhaps about it, there are certain questions for these items, and you can check it online as well. We don't have time, unfortunately, to go through each one in detail. And finally, and this is really critical, no, it's still the same slide, sorry, just about the unintended consequences. It is very important to look at whether your intervention or in the evaluation as evaluator to see if the intervention you're evaluating, it has led to some unintended consequences, things that you did not plan in your program theory before, or your theory of change or logical framework that you didn't plan, but something happened out of the intervention. It could be positive, it could be negative, but it's very important. And it's here because it's also linked to equity. How did your intervention have influenced people who were not targeted by the program, but benefited positively or negatively? It is in your interest as a policymaker, government official, evaluator, to know what your project outcomes have been, even if you didn't plan for them. Next slide, please. So I'm conscious about the time, and these two slides, the last two slides, I will go with them, go through them quickly. But I thought it's very important to share with you, because we are talking about the multiplicity of equity aspect and dimensions, but also there's also multiplicity of evaluator rules. Think of them as hats that we put as evaluators. Sometimes you are a methodologist. Sometimes you are like a judge. You go and say, oh, this is done well, this is not done well. Yes, you have to do this sometimes. But at the same time, you also could be a facilitator, social scientist. But this one I have been advocating for and wrote about, and many colleagues in the evaluation field. Also, as an evaluator, you're an advocate. You're an activist. It does not mean you're activist that you're not objective. You are objective. You're using rigorous tools, but you are advocating for addressing the needs and interests of the most vulnerable peoples. So when you do such things, I don't think we should feel guilty as evaluators advocating for the vulnerable. It's one of our main roles, actually. Next slide, please. Finally, we talked about different challenges to equity and social justice evaluation and assessment. But also there are, within the framework of working, for example, with governments, with the donors, with development partners, with every environment and context, there are also many challenges evaluators, but also commissioners of evaluation face, that I thought it's useful to just quickly look at them and think about them. Maybe also, if you have the slides later, or you can read about it. It's from House, 1995, a great author about equity and social justice. This he did not write in the sense of in relation to equity, but it's applicable here. So one thing that we see, that evaluations that are not inclusive, what is not inclusive, Michael said about what is inclusive evaluation. We can also think about what is not inclusive evaluation. Evaluation that is focusing on the client itself. The commissioner. If X and Y has hired me as an evaluator, I am going to do exactly what they say in the TUR, what they want, what's their interest, and not look at the interest of other people in the community. Very similar to that, it's the contractualism. You're adhering to the contract 100%. You will not go and look into unintended consequences because it's not in the book. It's not there. Or managerialism, thinking about the manager, even worse than clientism. But this fourth one, I want to draw your attention to. Methodology. That is focusing on methodology, thinking that methodology solves all problems. Now in the evaluation field, thankfully, the evaluation, there's so much advocacy for evaluative thinking. Evaluative thinking means you are systematic, but you are evaluating, understanding the context in a critical way, not saying this is the gold standard tool, RCT, or so on, or so, there are so many tools, and even the best tool has problems. And of course, you have relativism, that all viewpoints are important. Yes, but there are some people who have so much disadvantage and power. If you have their point of view in evaluation, of course, they have more influence. You have to be careful about this. And finally, it's elitism. It's also a big problem, that you look at the interest and voice of the powerful stakeholders only. And this is a plague, I think, in evaluation. It's many evaluators with good intention that are doing great work. I'm not saying the evaluation field falls into this, but I mean the processes, that if we think only about elitist way of doing evaluation, not doing this hard work of what we said, then it's a problem. And finally, I just want to say that we all, I think from my colleagues also, they have similar experiences, they have great experiences in the field, and they will say that this is hard work. This is many challenges to inclusive evaluation. It's not easy, but there are tools. There are tools in the evaluation field. I'm not talking about methods as tools, like tools in the evaluation field and policy making that is very important for equity. And with intentionality, care, and hard work, which I think is much more important than tools, it can be achieved. And when done, it can truly be transformative rather than check box, we did evaluation. This can be transformative work. It can really have genuine impact on people's life. Apart from so many interventions, that's so much money, and then we don't see any change. And it's very important, as Mr. Kimura said, about thinking about the SDGs. Now the whole world problems with pandemics, COVID, conflict everywhere. I think it's more time than ever. And usually I end with the presentation something about this. I say, if not now, when? And if not us, who? I think it's good to ask ourselves always, if not me, who will do it? If not now, when to do it? Thank you so much.
Thank you very much, Khalil. Very, very powerful words, especially at the end. If not me, then who? And if not now, then when? I'll quickly pass it over, knowing that we have time for Q&A at the end. I'll quickly pass it over to Dr. Renu Singh, who will talk to us a little bit more about disability and persons with disability, how they can be included in evidence generation. Over to you, Renu.
Thank you very much. Good afternoon to the chair, to my co-panelists, and of course, everybody who's joined us this afternoon. It's a pleasure to be talking with all of you here. I think I'm just going to start by echoing what Khalil just said, that, this is the time to do it. And I think I'm going to, what I'm talking about is, are we really counting what really counts? I think with the SDGs, as Mr. Komoro said, just 8 years ahead of us, we have a lot to work towards. So I don't think there is any more better reason for us to make sure that all our evaluations are inclusive, other than the fact that, and I'm going to focus this particular presentation on persons with disabilities and young people who have been championing for many years and saying nothing about us without us. So are we really being inclusive and making sure that our evaluations are an integral part of the project life cycle that contribute not just, to a report at the end, but actually contribute to project improvement, organizational learning, and more importantly, accountability to all right holders. And in a federal system, as Mikey mentioned earlier, I think this is even more important that we involve all stakeholders and right holders and ask ourselves questions of whose voices are being heard, who determines the focus and the purpose of evaluations, whose knowledge is actually valued. Because what do we see today? Often the weakest voices are those who are on the margins, are the ones whose voices we do not capture in our evaluations. So particularly young people, as well as those with particularly, and I'm going to focus on those with disabilities, are left out. And the reason, and what does it contribute? We know that there is very little evidence that we even have today, and rigorous evidence which provides us, a good reason to look and address those gaps. So I think I don't think this is the time to ask why, because I think we all are on the same page. The question is, how do we do it and move ahead? Can we have the next slide, please? So in terms of the policy context for persons with disabilities, we know that, there are about 600 people who have a disability of one form or another. And over 2/3 of them live in developing countries. In India alone, we have 26.8 million people with disabilities who were reported in our census 2011, which was 2.2% of our population. And at that time, we did not have the Rights to the Persons with Disability Act 2016, which now talks about 21 different types of disabilities. At that time, we had just captured, sensory as well as certain multiple disabilities. So, right now our numbers are going to be much larger. And of course, the fact is that we do have very little evidence related to the realities and their lived experiences, though we do see a change in the last 3 decades, where we have moved from the medical model, where we were constantly seeing how do we fix people with disabilities, to the social model, which is a social construct, which says it is the environmental barriers that actually cause the disability and not the impairment alone. So I can be a person, I know, for example, I definitely have refractive error and I can't see if I don't wear my glasses. Now, if I didn't have my glasses and I didn't have access to these, I would definitely be disabled. So I'm making this very, very rudimentary, but I'm just giving an example. So the question is, it is definitely we move to the social model of where we are looking at the environmental barriers also causing limitations in access, both participation as well as access to services. And I think with the signing of the UNCRPD, the UN Convention on the Rights of Persons with Disabilities, India is a signatory as well. I think this is what made us actually move to amend the PWD Act, the Rights of Persons with Disability Act in 2016, to ensure that we are looking at a rights-based biopsychosocial model of disability. So that's the policy context in which we are discussing. So yes, I mean, I'm going to take an example of a recent study that we did. This was looking at exploring education and occupational trajectories of young people with disabilities. And it was very challenging because we did this during the pandemic. So we had the good fortune of having been running a longitudinal study since 2002, where we've been following almost 12,000 children in 4 countries, including India. And we decided we would reach out to the young people with disabilities within our sample, because in every round we had been asking them to self-assess, as well as we used the Washington Group question on disability. So it was easy to know where they are. We had their telephone numbers. We'd done a tracking round. So that was not so difficult. We knew where they were. Yes, we had not had any specialists ever assess them. These were all through self-assessment. So the first thing we had to do was put together, during the formative stage, a team of special educators across disabilities, because I think I'm going to go back to the point that Khalil just talked about, the intersectionality, where we look at disability as one identity, but actually it isn't, because people with disabilities, even within the same disability type, for example, say somebody with visual impairment, you can he referred to tunnel vision in his slide. So you can have tunnel vision, you can have refractive error, you can have, you can have stigmatism, you can have, it could be low vision, you could be blind. So even within a disability type, you can have different varying degrees of impairment. And more importantly, these are impacted by all your other identities. So are you a girl? Are you a boy? Where do you live? Are you from the poorest wealth quintile? Are you somebody who are you SC, ST? Are you, which religion do you have? What kind of cultural background do you come from? What are the expectations of the household towards you? How supportive they are? There are a whole range of factors, rural, urban, because services are much more easily accessible in urban areas than rural areas. So the question then becomes, especially for people with disabilities, the intersectionality needs to be taken into account, of course, their age, their gender, etc. So we had to then therefore have specialists who special educators, because even special educators have specialisms. So they, those who have the specialism in intellectual impairment and those who work more with hearing impaired, visually impaired, we had to make sure the formative stage, which ran a pilot. We took young people from outside our sample across disability. We also made sure, because we ran into a lot of challenges, because we were going to use tablets to run the interviews, because our qualitative and as special educators, researchers could not actually travel to the field. So we were going to use community guides. I'll tell you more about that as we go forward. But we really had to make sure that, we had the means to use sign language for people with hearing impairment. The questionnaires all needed adaptation, because if you had a person with intellectual impairment, you wanted to make sure that you gave them the opportunity to respond by making your questions more simple. So there was a lot of work that had to go in even before the study started in the formative phase. May go to the next one, please. So like I said, we had to use technology. Our, special educators made sure that, we had questionnaires which were specially designed for different individuals. We used community guides from the communities who actually knew those areas and those communities. They took tablets, because digital divide was tremendous, and it isn't about we want to use tablets and it's going to happen. So we had to make sure the community guides went to the households, put on the tablets, made sure that the person being interviewed, because this was mixed methods, we had the quantitative data already with us, but we had to run the interviews by making sure that these people were comfortable using the tablets. They understood and they gave their consent. The household members, more importantly, the enumerators had to be trained, because community guides had to put on the tablets and then move away and make sure they were not causing any more impediment to the interviews being held, and they had to follow very strict safety protocols. But more importantly, it was also a challenge, because our special educators, most of them were working at, for example, those for working, the specialists who came in and worked with people with intellectual impairment actually came from NIMH, and they were so used to jumping in to provide interventions, and so they had to also train them during the evaluation to say, just gather the information and we will make sure that we will go back to them with the information they need. And I think we were really lucky, because we found people who knew local language, who'd been working in the field for very long, knew the realities, but also we created a research committee which had people from the ministry at the center, from the Department of Empowerment of Persons with Disabilities, and also the disability commissioners from the states were involved, along with other people, so that we constantly were able to work with policymakers to make sure that even the questionnaire was appropriate, and we were going to capture information that policymakers also needed. So, going down to looking at occupational and educational trajectories, but also making sure the policy piece was fused into it was really important. We go to the next one, please.
Renew 1 minute.
Okay.
Thanks.
Can we go to the next slide, please? Right. So I think some of the more practical suggestions, that I would just like to leave you with to think about is how do we ensure during the formative stage to make sure we're asking the right questions. Teams must consist of local experts. Mixed methods, absolutely essential if we want to go down to understand granularity. Make sure that our questionnaires and people conducting the teams are aware of the culture, the feedback mechanism that already Mikey spoke about. How do we make sure we go back and provide the information that we've gathered and get, make sure that then mid-course corrections are made, and if there is exclusion that we find, how do we plug that? That is so critical. Can we have the last slide, please? Yeah, thank you. So I'm going to stop right now because I know I've kind of taken over my time. Thank you.
Thank you. Thank you, Renu. That's great. Perfectly on time. And thank you for giving a very concrete example of something that you and your team did around disability. And clearly, it's very difficult. And one of the ideas I think that we have talked about before that I'd like to still plant and reinforce is something around doing a formative piece before you even start an evaluation. Are you asking the right questions? And it sort of segues very nicely into our last speaker, Ritu, who will be speaking to us about her experience in gender transformative evaluations, gender inclusive evaluations, and some of the examples that she has done and worked on to actually make sure that the voices or what matters to women is captured in the evaluations that we do. So Ritu, over to you, if you're connected.
Thank you, Mikey. I apologize. I'm joining from my phone and the video is not working. Today, I'm going to share very critical pieces of my life. Would you like to listen? I started my career with research and M&E, but soon I realized that communities have to be at the center of development. And then I started working with communities. So today, with humility, I present the learning from the staff and communities of Avni, CNES, Constellation, Faith Foundation, and VHAA. Next slide, please. So what does inclusive evaluation mean for me? It means an evaluation which transforms, particularly from gender and equity lens. To examine gender outcomes in evaluation, as Shrilata Bartliwala puts it so simply, that we look for shifts in power relations, like control over resources, division of labor, decision-making, etc. But this still is not enough. And as the presenters before Khalil and Renu have highlighted, the need to look through this from intersectionality lens. Gender and other vulnerabilities intersect. Yeah, so how did I use this in my lens? Let's go ahead, please. Next slide. I work with Global Fund for Children, which is a small grant-making organization, and the focus is on trust-based philanthropy. Traditionally, those who commission evaluation or funders hold the power, isn't it? And with my MEL portfolio, it further enhances and increases this power. So I started thinking, how can I hand back this power? And what I try to do is facilitate the partners we fund to help them realize their strengths, that they are the experts of their domain. They know their context best. We are not monitoring them. They can track their own progress. We trust them. Then you will think, what is the role of the grant-making organization? We are there to learn from the NGOs, but even more importantly, learn from those with the lived experience and listen deeply to them. I'll give you an example. Before COVID, one of our partners, Avni, in Maharashtra, they conducted gender equality modules in schools for students. And they had these pre and post questionnaires, which gave them an understanding that the knowledge had increased. But what was the result of this? Were the students actually applying this in their life? So we helped them to use more significant change methodology. We together created what was the template to collect these stories. And then I could hold the space and help them analyze what did these stories mean for them. You know, there is a risk to this methodology. We often see mostly stories of success. So could we get the reality as well? As the trust between them and me was growing, they were realizing that this was the opportunity to learn. And then comes a story. First, the stories of success. The boys were helping their mothers at home in household chores. A boy had stood up for his sister and that she should be allowed to study. And then Avni came with this story, which really shook us all, is that one of the leaders of the children's group who was advocating for child marriage, she herself was married off by her family at a very young age. And that is when this Avni team, and I must really appreciate them, very honestly said that there are changes. We acknowledge that, but they are not deep enough. The children are not able to challenge the patriarchy. And we now need to adapt our own program and move to working more with families and communities. And what I learned from this experience is that it's not only about this tool of MSc, it's more about facilitation. Organizations genuinely want to learn and improve if we create the brave space. It is not a fail or pass test. So I started questioning that our evaluation practices leaving room for risk taking. Are we trying to learn? So is it about improve or is it about prove? Yeah. So these pictures are from that story collecting process. Okay. Next slide, please. We continue the journey. Yeah. So yeah, I have also been thinking that who produces knowledge? Is it technical knowledge more important, or is it the voices of the people? And I've come to the conclusion that there is not one over the other. And I've been trying to do this through many ways. And one is making case for community ownership in evaluation. But I'll not talk about it today because yesterday in a session, it was done absolutely brilliantly. So I will share about another aspect which I have given my heart and soul and I really have facilitated it for a long time. And what I'm saying is, let's add another layer of measurement, and which is community-led self-assessment. Next slide, please. This, what I'm saying is that encouraging communities to assess their own progress and measure and take action based on their progress. And I am going beyond community-led monitoring of service providers, but they monitoring themselves. Yeah. And I have been using Constellation's community life competence process. It has been used in 60+ countries and many states here in India. It is a strength-based approach. And if you see this action learning cycle, each step of this cycle builds a sense of ownership. The entire intervention is designed, implemented, and measured by the communities. And what do we do? The outsiders just walk along using the SALT approach. They appreciate, they listen, and learn. And they learn how to let go and believe that communities can do things for themselves. And also link them where the communities cannot address that issue. So it is not one over the other. Everyone joins hands together to address. And as Renuji was talking about, it's a very, very complex situation and multiple stakeholders need to join hands to address it. Next step, and I'm going to tell this cycle through a very short story. Next slide, please. Yeah. So we worked with 90 villages in Assam. encouraging these villages to take ownership and address the issue of child health, particularly routine immunization. Next slide, please. And what did we do? We started with salt visits to the women at home who could not be at these meetings. But we also did not want to give the message that it is the mother who's responsible for the health of the child. And we start salt visits to men, women, grandparents, children, youth in the village. And that is when the communities realized their strengths. They had done many things in the past and they could do so many things. They developed a sense of pride. And next slide, please. We asked them what is their dream for child health in the village. We had no activities. We wanted them to take ownership of what they wanted. Next slide, please. And from this dream, this shared dream, 90 dreams, no plan coming from Delhi, me based in Delhi sending them. 90 dreams, and from these dreams come 90 self-assessments. So then the community, we developed the self-assessment based on their dream, the practices which were needed to achieve the dream, what they would do. And let me take you to this beautiful village where a conversation is taking place, and the conversation is on immunization. All the people sitting here, men, women, older people, they say, we are at the highest level because everybody in the community is immunized. And then the Asha, the health worker, gets up and she says, sorry, but not everybody is immunized. You do not complete the immunization schedule. And then everybody looks at the mothers, and the mothers say, we do not even know why immunization is given. Some of us do, but not all. And we do not have the time. And the boys say, do you expect the fathers to take on this role? And then a discussion starts, and that is when the community finally decided that that other family members would take the responsibility of immunization. Yeah, and then many things happen. But what I'm saying is that when this community did third self-assessment is when they realized that they were doing a self-assessment. And they said, these are the report cards. We never realized, but there's no teacher. We are our own teachers. Yeah, so this sharpened the evaluative thinking, which Khalil was talking about, posing questions, reflecting, generating data, but also using the existing village records. It also, I think it can provide a kind of a needs assessment for the service providers, that things communities can do, because these will show what, and contextual, because different villages have different self-assessments. And it can help the providers to chip in. So it is not that communities can do everything themselves. And it is not that the service providers can provide everything. Yeah, next slide, please.
Ritu, we have 3 minutes.
Yes, please. Yeah, so they start reminding each other from the immunization cards that we are not missing our schedule. Next slide, please. And then the fathers and the grandparents start taking their children for immunization. So, yeah. And no one makes fun of the fathers that they are taking on what was feminine roles, because it is the dream of the village. So the power of the dream. Yeah. Please, could you go back to the previous slide? Okay, so we could not, if there's a question, participation is not possible, then what do we do? So our team, Faith Foundation in Meghalaya, they conducted a study during COVID. We could not involve the community in this study. It was on teenage pregnancy, a very sensitive issue. So we wanted the community to take ownership and take action. So what did we do? We invited the young people, shared the findings with them. They said, this really relates to what is happening in our village. And we said, would you like to share this with your own village? Wow, yes. How will you do it? We want to do silent theater. Let them decide how they want to share. They prepared the script, and then came the day. Next slide. The last slide. Then comes the day. There are 70 people in this village. People from 5 villages come. The DC comes, the village headman, the SAGs, and they share the skit where the parents and children are not having a conversation on sexual and reproductive health. A girl gets pregnant, she drops out of school, and her partner abandons her. The message was very striking, and the community said, we are now going to work on this issue. But what the NGO, the Faith Foundation team, they remarked was very powerful. They said, even if we had decided to do the skit, even if we had dressed up as characters, we would not have made that impression because these people acted as they were. And that is when this ownership journey started. Sorry, there's one more slide. And you know, if I recall and review all the work I've been doing, for me, it is what Donna Merton says. It says that it's like, you know, the salsa dance, one step forward, one step back. This is how it is, facilitating these. And therefore, Khalil talked about facilitation. It is very important that we develop the skills to hold deep conversations, bring together diverse groups. And I just conclude with one point is that if we become facilitators from interventionists and telling people what to do, citizens and communities can take care of themselves. I don't think we have to worry about SDGs, but the question is, are we ready to let go? Over to you, Maike, and thank you everyone for listening.
Thank you, Ritu. It's wonderful to have your journey told through a series of stories, and I think it makes it a very tangible journey of an evaluator. And talking a little bit, I think, also of what Khalil was saying, moving perhaps away from the strict methodologist view and thinking of we should be evaluative and co-creating, you know, what matters for especially those that are often excluded in policies or programs or any of the other development efforts. So thank you very much to all three of our panelists. Fantastic reflections shared. And again, I think it's become very clear that this is not necessarily easy. Khalil very rightfully started off with that caveat at the beginning. I will now just pose a few questions, and thank you everyone online for still being here. And please do, if you have any questions, put them in the Q&A box. But to kick us off, I think I'll ask each of the panelists one question, and it's also with the view of how do we make some of what we've been talking about inclusive evaluations. It's very complex. There's multiple facets. It's dynamic. You know, it's actually a very complicated undertaking. How can we try and make this more practical? And we're thinking about evaluators, we're thinking about users of evaluation findings, we're thinking about communities themselves, and we're thinking about policymakers and decision makers. And I think very rightfully a theme has been multi-stakeholder. There's multiple people involved in this, and every one of them has a different thing that they're looking for in an evaluation or in an evidence effort. So how do we make sure that they are all aligned and we address all of them? Khalil, I think the first one that I would like to ask to you is you raised a very interesting point around unintended consequences. I think that is also something that we talk a lot about is in the OECD DAC criteria that we use for our own evaluations. Can you perhaps suggest one or two practical tips or suggestions around how evaluations can actually examine unintended consequences? What do you need to do to ensure that you capture them rather than sticking to these are the questions I need to ask and this is what I need to look at? So over to you, Khalil.
Thank you so much, Mike. This question is very important because I think this one particular thing in evaluation that I feel we are closely getting afar from, although we should be more. You're rightly so in the DAC criteria, a lot of the UN evaluations really mention that in the TUR. But then I think just to say, before saying that maybe that the tips or ways of doing this, I think it would be helpful for colleagues, and I'm sure many of them see how evaluation became more now of a theory-driven evaluation. So the evaluator comes, he has or she has a TOR, and the TOR has the DEC criteria or sometimes ALNABI criteria if it's a humanitarian intervention, and says this is the evaluation questions. Already there are so many evaluation questions to cover and so many things to do. And the questions are on the theory, on the project, the program, or the intervention, logical framework. So that's where we don't see about unintended consequences, because long time ago in evaluation, actually the father of the evaluation field, Michael Scriven, he suggested something called goal-free evaluation, where we do evaluation without coming to the program and thinking, oh, what is your theory of change? What is the results you want to achieve? The evaluator goes and really dig and search for those effects of the program. So now almost, I think, big percentage of the evaluations are theory driven, and this is understandable because we have accountability and learning, not only learning, and people want accountability. So I think one way that I found useful reading about it, but also doing it as a practitioner is I think what Rito mentioned, about being this whole notion of being open to learning and listening as an evaluator. You go to do evaluation. Yes, you have those sets of questions, any criteria, but it would be good to be open to what people say, and sometimes not be so strict that you have semi-structured question interviews and you stick to this question, and if the right holder you're interviewing say, oh, but I experienced this thing, you say, oh no, this is not really in the evaluation metrics, I will not listen to this. So it's the inquisitive. Again, we go back to this whole notion of evaluative thinking. So the evaluator is like an investigator trying to find all the useful thing, not in a negative sense, but in a positive sense. So this one thing, I think it's been open. And the other thing is to really deeply go into the whole thing with intentionality thinking. Actually, sometimes some interventions could have such much more greater influence on other things that they are not planned for. Sometimes positive, sometimes negative, but sometimes also positive, as we said. And it's a shame that, most of the time now, because it's theory driven, you see an evaluation says, this project changed people's life, blah, blah, blah. And it's like a small budget, small activities, and change people's life, But if you don't measure the unintended consequences, you only focus on very limited things. I hope this is helpful, but I think it's listening and digging. These two words, I think.
Listening and digging. I love that. That's great. Thank you for that, Khalil. And I think that's just giving us a few tips on how to do that practically. I'll move on to Renu. And Renu, I'm going to ask you a question because it links to the example that you also had, and you mentioned it in passing, but I wondered if you could expand a little bit. I think, like we've been saying, the key challenge perhaps of any evaluation is making sure, the multiple stakeholders who are involved in, for example, implementing a program, whether it's, a government official and the community and the evaluators and everyone else that might be users of evaluations, how we can get them to all agree on what the approach is and to get out from an evaluation what they need. Through your experience, do you have any suggestions on how one can build such consensus, especially because it's so difficult around issues as disability, like you said, to even recognize the complexity and the intersectionality around it? Do you have any suggestions of how one can start building that consensus, some of those practical steps from your experience?
Yes. Michael, thank you for that question. I think right from the start, I think if we, like we've just said, often communities, we do evaluations not with communities, but we do it for the donor. And I think we need to change that mindset right from the beginning. So if the evaluation is with the communities and you're saying that they are the ones who are the key stakeholder rather than us, and we are just a small little fly on the wall who are just facilitating the process. And also, I'm sure I don't mean to demean the role of evaluators when I say that, because it's a very important role. As long as we are learners and we are facilitating the process of making sure that we are capturing the most marginalized voices. And I think if right from the beginning we approach block level, district level, state level, central level officials as well, so that the Panchayati Raj has such an important role to play, for example. And if they're all usually very forthcoming if we involve them right from the formative phase. Often we only go to them when we are ready with the questionnaires, it's all done and dusted, and then we go and approach them. I think it's also it's really about the power dynamics in this whole process. I think if we see ourselves as learners who still have a lot to learn, because it's a fact, when you do, when you're doing your pilots and you're working on the formative phase, I'm constantly reminded of how little I know. And so much that I missed out unless I have spoken to the critical stakeholders who have so much to inform the process. So if we do that, I think it's really about the planning process taking a new sort of a turn. Because only then will we be able to really do justice to making sure our evaluations are inclusive and we have actually everybody on board. Because ultimately, it's what we do with the evidence that is more important than only gathering the evidence.
Thank you,
I
Renu.
hope that answers the question.
That's great. And I think the key message is do it from the very beginning, from the design phase, because otherwise that co-ownership will be very difficult to build during the process or even towards the end. Ritu, I had a question for you because you mentioned, many of your examples that you talked through as an evaluator. Again, it's about listening openly, and I think Khalil has reinforced that. It's about learning and also asking the question, why? Why is this happening? It's about, what does change mean for a community? What do they want to see? What do they think is important, right? And those are, of course, I think fantastic approaches to understand what outcomes and impact mean for them. The question really is, how do you take those approaches that you have used and thinking about it? And I'm also thinking about, there might be commissioners of evaluations that are listening in, thinking, how do I do this more systematically? It's great for Ritu to be able to do that when she's going out there, but I don't have the luxury of doing that. So how can I integrate some of this into a system where I know that I'm able to do these sorts of, really important activities of actually finding out what matters to a community or to the rights holders. At the end of the day, that's who we're focusing on. So any reflections from you on that, or any suggestions that you might have?
Yeah, I'm also learning. I don't know everything, but what I have, one thing I feel can be done is thinking, how do we give ownership to those most affected, and being very open what we could do or what we could not do. Like when we were facilitating for an NGO, the Sabla program, what they were doing for the Sabla program. We had very limited budget, but we really wanted, it was for adolescent girls, and we really wanted their voices. So what was possible is we got these girls in design. So we held a workshop and they designed with us. And we asked questions, if you were to design this intervention, what is your dream? And and if you want to know what is the result, what are the questions you will ask? And who will you involve? We had gone, and I must admit that we had an evaluation design in our mind, and we had a list of respondents who we'll interview. But and what the girls said, have you thought of talking to the boys? Because what happens is when we try to go to school, the young boys stand and kind of harass us, and we, instead of going inside the school, we go back home. So please go and talk to the boys. And that was not part of our design. That we thought it's a girls' program, we'll talk to the parents. So this is the value which brought, so it's important that who owns it and what is possible for us.
Thank you, Ritu. And I think you also mentioned a very important challenge that I think comes across all three presentations as well as we talk about it, that, there's always these constraints of time and feasibility and budget and all of these things that mean that some of the approaches that we might want to do may not be very feasible. And what is it then that we can still do that means that we have an evaluative lens in what we do and an inclusive lens in what we do? And I think, working from what is possible is really important. To that last question, there's one last question, and then I'll take one question from the audience Q&A that I've seen there. And maybe I'll open this up to everyone because it links to this. It is really about that some people might say, doing inclusive evaluations, the way that you've outlined some of the activities and the examples that you've been doing, I don't really have the time or the money for that, right? So A, what can I do? And B, that may be a tendency why we often default, and I speak also as an evaluator, often default to perhaps not doing things as inclusively as we could and not having the prep and planning stage as Renu mentioned. So, what is that thought on the tension of that? At what point do we say, well, go ahead and do an evaluation? And what point can we do things that actually mean that it's still inclusive, even with things like we don't have the time and we don't have the money for this? So anyone who wants to jump in, any reflections on this conundrum before I open it up to one of the audience questions? Anyone? Khalil, Renu, Ritu?
Ritu, I think. Ritu say it.
There is one thing which Khalil mentioned, and I think it's so important. He said it's not only about the evaluation. I think it's also about the implementation. And so I have done the traditional evaluations where the project was participatory. So I think in implementation, if we can have process like participatory action research, where communities are involved throughout the process, and then it'll be very easy for the evaluation professionals to do it. So it is actually those who are funding, do they want to do it? That's the question. We all sitting here want to do it, right? So the question goes back to who holds the power.
Thank you, Ritu.
Can I just come in, Mikey?
Sure,
I just
please.
want to add, I think, I don't think today we have a choice. And, people who say we don't have the money or the time, I think they really need to think hard, then why do the evaluation? Because I don't think, the inclusive lens is a methodological consideration. It needs to become a normative construct guiding all evaluation practice.
Yeah.
Yes, I don't think there is a choice any longer, because if we do what we've always done, we're going to get what we've always got, and we are not going to achieve the SDGs.
Thanks, Renu. That is very clear and very powerful, the way that you put that. Khalil, I don't know if you have anything that you would like to add?
I was going to say, but then I hear Renu for the last one, and I was like, okay.
And on that note, on that statement.
Exactly.
Thank you, Khalil. I think the last question that I'll take from the audience, we've got a couple of questions, and I think perhaps we can take those separately. But I think one of the things, Renu, to reflect on is a few parameters or checklists for doing evaluations around during the pandemic period. I think there was a question around whether or not that, how easy that is to do, what are the challenges, what are the checklists, perhaps, I think linked to the example that you had shared, if you could perhaps share very quickly a few points around that, just because I think the audience is very interested in that, and then we'll take it to a close.
Yeah, I think Khalil already, gave us some of the parameters in his slides, and I think we can, everybody, I don't know if the PPTs are available, but so I think they can be referred back to that. But I just want to say that we've been we've conducted 5 telephone surveys during the pandemic. If you go to the Young Lives website, all the questionnaires are there. They're in the public domain, including the data is also there. If somebody wants to mine the data, that's also there in the public domain. So I would suggest, because the fact is that depending on the rights holders who you're going to work with, I think it's really important we ensure their voices are captured. And like Ritu just mentioned, are we talking to all the critical right holders who are going to also impact the lives of the ones who we see as marginalized at the moment and on the periphery? Can we make sure that we capture their voices as well, because we want to bring change? And ultimately, no matter what questionnaire, it's never going to be perfect. I'm sure all our questionnaires are far from perfect, but are we going in the right direction? And are we meeting that goal is all that we can plan for. So I don't want to be prescriptive by giving any one thing, because sitting here, I don't even know what the person asking the question really wants to study.
Thank you, Renu. And I think just for everyone's reference, we have a couple of resources, and especially Khalil's very, very interesting checklist that he has, or the assessment tool. So please do refer to that to see how some of these parameters can be built into evaluations. Right, it's 1 o'clock, so I'll hand over very quickly to Yas to close the session. Yas, if you're still there, over to you for the final remarks.
Thank you very much. Big thank you to all the panelists and the participants and audience for a very rich and insightful discussion. I really appreciate the passion. Dr. Singh just mentioned, we don't have a choice. For the realization of SDG, it's all 8 years left. So really agree with you. I really appreciate your passion as well. It was really inspiring to hear the innovative work that you are all doing to make evaluation and policy making more inclusive. I take away a few critical points from this session. First, there are many complex aspects and dimensions of equity, exclusion, and inclusion, and which often intersect. For example, conventional data collection may tell us the impact of COVID on women in the informal economy and on persons with disabilities, but only a fully intersectional, inclusive, and community-first evaluation will tell us what happened to women with disability who lost work and whether they were able to access healthcare easily and so forth. The second, this means that inclusive evaluation must define the outcomes that matter for the most marginalized by using the participatory approach and also looking at unintended consequences. That last point is very important to remember. Working on such complex issues as children's rights, if we do not forecast and examine the unexpected, we will not know whether a program is doing more harm than good. And finally, while we know that there are challenges in trying to make evaluation and evidence inclusive, the panelists have shown that it is not impossible. There are tools that evaluators can use, such as the SEAT, with more careful planning and some upfront investment, it is possible to design robust and inclusive evaluations. Even if this means evaluations take a little more time, the findings will be more valuable in getting us to the brass tacks of leaving no one behind. So thank you once again to the panelists and to the DMEO organizing team and all the attendees. Wish you all fruitful reflection from this excellent session. And I wish you all a very happy Holi. Thank you very much.
Thank you. Thank you, everyone. Thank you, the audience.
Thank you.
Thank you.
Bye. Happy Holi.